Welcome to Adapt NCLEX. Today we're going to talk about antihypertensive drug. I'm going to present it in a different way. We're going to walk through the whole of what? Antihypertensive. All the antihypertensive you need to know for the NCLEX. What situation, how to apply it, so that when you see a question, you can use it. What is the key fact? The NCLEX is not going to ask you, what is this antihypertensive? They want you to know, what does this medication do in which situation? So whose situation does it fit? That is the key. Once again, know which one it fit, which patient you can use them on, which situation is it okay to give it to the patient, and whether you need it right now. So as we walk through the all way of antihypertensive, I want you to pay attention to comorbidities, contraindication, urgency, and special situation. Are you ready? Let's get to it. You're going through the rooms, and therefore, our first room, what are we going to do? Your first patient you saw, you went to the door one, and what you see is a pregnant patient. And on the side, patient has hypertension. You do not read anything about the patient, but all you know is pregnant with hypertension. What medication can you give? That's all. Which one is acceptable for this patient? Write this down. Labetalol. Don't forget, that's number one. The most common antihypertensive you can use. 2, Methyldopa. This is the second one. 3, Nifedipine. This is the third one. There's 4 of them. And then Diuretics. These are key. I will put selective beta blockers, but you got to pay attention. Not all of them, but to know that selective beta blockers are very good for this door one. This is your first patient, a pregnant patient who has hypertension. You look on your left and you saw certain medication. When you see this, walk away. Don't give it to the patient. ACE inhibitor, run away from it. ARBs, run away from it. And atenolol, like I told you, this is a selective beta blocker, but it's not good for pregnancy because it causes growth retardation. How do you remember this rule regarding beta blocker, or which one is the best one? In the pregnant patient, this is your mnemonic. Pregnant patient, labetalol is what? Lives here. It lives here because it's the best medication for labor. Labetalol is the best medication for labor, and therefore it lives here. That's your mnemonic. That's how you can remember labetalol as the use of best antihypertensive for pregnant patient. Door one, conquered. How did you do? You master it. Let's go. You went to the next door, door 2. What did you see? Door 2. The patient is wheezing. Oh, something is wrong. He has audible wheezing, and you can hear it. And when you check, patient has COPD and asthma. And they said patient has hypertension. Therefore, what are you going to do? Which medication you're going to give this patient? That's all. NCLEX is not going to ask you what is this medication, which situation you use it, when it's not indicated, and when you should question. That's critical thinking. Why don't you master this? Safe entries. Which one should you give them? Which one is the best one? ARBs are okay. ACE inhibitors, pick them. Calcium channel blockers, pick them. After we finish all the way, I'm going to give you specific class of medication, what is involved, so that you can master them. And Thiazide are okay for this patient. Very good medication. So these are medications that you should give to the patient who has what? Asthma, COPD, and what? Hypertension. You see, straightforward. When you look on your right side and you see this, wrong answer. Don't pick. Run away from it. Run away. Which one is it? Non-selective. We call them non-selective beta blockers. They are bad. How do you know they are non-selective? If you start with A, if you start with B, it's a selective. If you start with A, it's a selective. If you start with M, which are laws, right? These are all law. They are all law, which are beta blockers. So bisoprolol, atenolol, metoprolol, these are what we call selective beta blockers, because what? They bind on B1 receptors. Your lung has 2 receptors, right? Beta 2, because you have 2 lungs. So non-selective bind to what? B1 and B2. Selective ones start with the B, bisoprolol, atenolol, metoprolol. Know this one, so that when they give you anything like propranolol, you know propranolol does not start with the B, A, and M. That is a non-selective, and you should never give it to an asthma patient. Door 2 is conquered. How are you doing? I know you're doing great. Let's move to door 3. Door 3, what do you see over there? The patient has diabetes and he has proteinuria. Oh, something is not going well. I know he doesn't have preeclampsia. And at the same time, patient has hypertension. What do you see? Diabetes, proteinuria. That is what? Nephropathy. You have diabetic nephropathy. When you hear this, what should come to your mind? There's certain medications that are very, very good. Your best choice is what? ACE inhibitor. If you see your question, this is your answer. If you don't have ACE, ARB, because what? They are what? Renal protective. I'm giving you straightforward information, adapt NCLEX way, so that you don't have to memorize, so that when you have last minute exams, you come back to this crash course and watch it and said, yes, I know. If you have diabetes and proteinuria, diabetic nephropathy, and you have hypertension, what medication I'm going to choose? ACE inhibitor, ARB. Therefore, what is the mnemonic? If you hear about sugar and if you hear about protein in your urine, think about what? ACE inhibitor or ARB are my favorite room I have to deal with. Now, let's go to room 4. Room 4, door 4 is the best one. It's my favorite, door 4. What is the problem? Alarm bell is going up. You hear the alarm bell, and all you see is blood pressure is what? 220 and 120. What does that tell you? Don't sit down, because there's an alarm bell going on. You don't sit down. You don't educate. Once again, don't sit down, do something. Pick an answer choice that you're doing something, and you don't educate the patient about anything. This is what we call hypertensive emergency. What do you need to do? Give them something that will drop the blood pressure quickly. When you run, what are you going to look for? Nicardipine. This is your friend. You're looking for Nicardipine. You see, calcium channel blocker. You're looking for Nitroprusside. These are what? Nitrate. If you have Labetalol, good. Give it to them. What is the key? NCLEX is going to trap you. Hypertensive emergency, IV medication. No PO medication. Never give anything through the mouth, because this patient is going to die. That is your draw 4. Do something quickly and then cure the patient as much as possible. Therefore, in what? In this all way or 4, when you hear about emergency, I need to do what? IV, and I slow drop the blood pressure. Don't drop it too quickly. Slowly drop it. Door 4 is conquered. This is antihypertensive drug crash course as we walk through the door of antihypertensive. Door 5, what is the problem wrong with this patient? Ejection fraction is 30%. That means the heart, when you pump, only 30% of blood comes out. What is wrong with this patient? What do you think? If my ejection fraction is 30%, that means I cannot pump everything out. It means what? I have heart failure. Heart failure patient, what medication are you going to use? Heart failure with a reduced ejection fraction. What are you going to do? You got to think about the pathophysiology. Okay? Pathophysiology. If you see calcium channel blocker, run away. If you see, once again, calcium channel blockers, run away. We'll talk about them like Verapamil, Diltiazem. We'll talk about each classes. But for now, just walking through the hallway and what you need to choose. There's some specific medication that are very good for heart failure. This alone I'm going to give you is a full heart failure lecture. Why? ACE inhibitor is going to protect the heart. ARB is going to help remodeling. Loop diuretics is going to help what? Get rid of the fluid. Thiazide, they're going to do the same thing. But there's one caveat. Beta blockers, people will say, hey, if I can use calcium channel blocker because it's going to slow down your heart rate or it's going to block you, why can't I use beta blocker? Beta blocker help you with remodeling. It protects their heart in this situation. They are very protective. Unless they use the word decompensated heart failure, you cannot use beta blocker. If there is no decompensated heart failure, it's okay to give a low dose beta blocker for patient in door 5 with a heart failure and reduce ejection fraction. Therefore, a weak pump. This is a weak pump. This is your mnemonic. When the pump is weak, stay away from anything that slow down the heart rate. Stay away. Anything that's slow, stay away. That means what? Calcium channel blocker. But you can use a what? Beta blocker. How are you doing so far? You're getting the strategy. NCLEX is not going to ask you the name of the medication, but in which situation you should intervene. In which situation should you choose it? That's the thing. That's what this crash course is about. In your dose 6, what do you see? Patient just had a heart attack. So post-MI. This is also very important. Patient just had a heart attack and he also has hypertension. What are you going to do? This is a life-saving combination. It's the same idea of that of a heart failure. You give them ACE inhibitor, help with the remodeling because the heart has got what? Because the heart now is in trouble. It's being injured. You need to remodel itself back. And in the process of remodeling itself back, you got to slow it down. That's why you use beta blockers. So beta blockers and the ACE inhibitor are your best medication if they tell you patient just had heart attack. So when you have a heart attack, we got to slow you down and then we got to protect you by allowing you to heal yourself. This is our door 6 and that's what we do in door 6. What do you think? Now, the patient that you went to door 7 is a special one. And he's dear to me. Special one. So he's a black adult, black male. And he has a new onset of hypertension. What medication are you going to give it to them? This is a specific group of people. He has no comorbidities. He has no other medical problem. No medical problem. All he has is hypertension. What are you going to give them? Thiazide, hydrochlorothiazide is best choice for these people. Or you can give them calcium channel blockers. These are specific. So when you see the question, pick this one. Don't pick ACE inhibitor. No, ACE inhibitor is not good. Not first line. It's not the first line. Not that it's not good, but it's not the first line. If I have to pick an answer choice and it says it's a black male, then I'm going. If the NCLEX one will want you to focus on the race, they'll put the name of the race patient there, right? But this is specific for them, and this is what you give it to them. Now, in door 8, we get into something special now. In door 8 is an older patient, elderly, right? And the patient can fall 4 risks. You know, You got to stay away from certain things. Their veins are fragile and they are very sensitive to fall. And therefore, take a medication that will prevent them from falling. You don't want to give them anything that will let them fall down. What do? You start with hydrochlorothiazide and the calcium channel blocker. You stay away from these medications. We call it Clonidine. They're going to fall down. You don't drop their blood pressure too much. You start slowly, as much as possible. That is your door, what? 8. And then when you look on the other side, door 9 is there. What is the problem? The patient heart rate is 48. It's already 48. Baseline, his heart rate is already low. What am I going to give them? I'm in trouble. What do you think? What should you stay away from these guys? Anything that will slow their heart rate down, beta blockers, stay away. Stay away from calcium channel blockers. That means Verapamil or Diltiazem. This is going to what? Slow them down. Your best choice to give to this patient is inhibitor, ARBs, hydrochlorothiazide does not drop what? Your heart rate. These are very, very important, and these are medication you have to pay attention to. Now, there is a specific medication, door 10, that you have to pay attention to. Door 10. This is Clonidine. The patient is on Clonidine and he's sleepy because it causes sedation. And therefore, what do? You check, oh, this is an expected finding. I'm not worried about it. It causes sedation. But what is the most important? Don't stop it abruptly. Okay? Don't do that. Don't. If you do that, you're going to have rebound hypertension. This is one of the most important things you have to teach the patient when they come to what? Clonidine, because it's a very, very important medication and that can cause a lot of problem. So you have to teach the patient, you have to worry about it, you have to care about the patient, and you have to make sure they're not going to do anything that will be really troublesome. Now, and your door 11. Door 11 is the last one. Door 11. This patient has stroke. What are you going to do? Previous stroke, what are you going to do? The long-term medication is hydrochlorothiazide. This is very, very important. Very, very important. So use it. Thiazide or ACE inhibitor. These are medication you're going to give it to them. We went through all situations. We talk about everything that you need to know about which medication you need to use, which situation. Now I'm going to give you the class of medication and when can you use it and when is it very important. The part 2. Now we're going to do the core bucket. I call it the key medications you have to know in the very crash course way. ACE inhibitors, what? What did they end with? They end with the pril. Example is lisinopril. Anything that ends with the pril, that's the thing. Enalapril, right? Captopril. These are ACE inhibitors based on the last name, right? What do you need to know about them? Why we love them? Because they protect your kidney. Like we said, kidney problem. They love your kidney. So if you have diabetes, we're going to give it to you. If you have MI, we're going to give it to you. And heart failure. That's very, very important medication. And the red flags we saw is what? Pregnancy. Stay away from it. Angioedema is a major side effect of this medication. It causes hyperkalemia and therefore be careful about hyperkalemia. And then it causes cough. These are very common. What is your priority? Not the cough. Not the cough. The most important is angioedema, hyperkalemia, and pregnancy. If they're coughing, just change it to ARB. That's all. That's what you should expect. ACE protects the kidney, but it harms the baby. That's the key. ACE inhibitor protects the kidney, but it's going to harm the baby. The baby does not like it. That's why you avoid it in pregnancy. That's all. ACE protects the kidney and it harms the baby. If you're having cough, then change it to ARB. How do you know I'm getting ARB? I call them the Satan. They have last name Satan. Example is what? Law Satan. I call them Satan, right? Va Satan. That's all. What is the side effect? It's the same as ACE inhibitor. What is that? The causes, they are teratogenic, therefore avoid it in pregnancy. They don't cause cough. They don't cause angioedema. These two, I call them no, but they causes hyperkalemia. Because of that, if you're coughing and you're taking ACE inhibitor, this is the medication we give you. There's no angioedema, so it's much better than ACE inhibitor. Now, beta blockers. What are they going to do? You have to think about it. Like I said, beta 1 receptors, this is in your heart. Beta 2, because you have two lungs, so your lung and your heart, right? It can bind to mostly your lung, and therefore beta blockers, you have to know which one you're dealing with, whether you have what, beta 1 receptor or beta 2 receptors. How do you know you're dealing with? We have selective and non-selective. If it's non-selective, that means it's binding to B1 and B2. If it's selective, that means it binds to B1. And which one is selective? I say BAM, which is what? Bisoprolol. You see? Atenolol. Metoprolol. So if I were you, this is the only thing I memorize. Or sometimes you have esmolol. But the rest, if they gave it to you, you know it's a beta 2 receptor non-selective, and you should avoid it in asthma patient. That's the key. What is their problem? They drop your blood pressure, you drop your heart rate, right? You drop your heart rate, and it's not safe in asthma patient. Therefore, pay attention. We talk about them, and these are the things you have to remember. This is one example so that you can know propranolol is what? Non-selective, and is a bad one. You cannot use it. Very, very important. It's not safe in pregnancy. Now, calcium channel blockers. There's a bunch of them, but I want you to pay. These are the ones I want you to know. The dipines are very important. If you don't know at all, these are the most common one the NCLEX will ask you. Nifedipine. If they want you to think very fast and trap you, they will give you what? These are the non-dihydrophenidipines. They are the non-dipines. I call them non-dipines. Verapamil. If I were you, I would know this one. Diltiazem and Verapamil. If you don't see that, that means they will give you the dipines. You see, this one is the dipines, classic calcium channel blockers. But if it's not a non-dipine, no Verapamil and Diltiazem. All of them lower your blood pressure. They causes vasodilation. That's the key. Vasodilation. Therefore, if you get headache because there's blood pooling in your head, your face, you're going to get flushing, blood pooling in your face. You get leg edema, blood pooling in your face. Your blood pressure drop. Blood pooling in your vein, you become orthostatic. Blood pooling in your vein, you see, the same thing keep on going on. You just have to talk to the patient about it. Of course, avoid what? Grapefruit juice is the most common thing. The NCLEX will ask you about calcium channel blockers. How are you doing so far? These are crash course on antihypertensive. I'm going to give you the key thing. If you know this a little bit, you know everything about pharmacology on antihypertensive. And these are my favorite because these are strong medication NCLEX has to ask you. There's a lot of them, diuretics, right? There's a thiazide groups, key. Example is hydrochlorothiazide. For blood pressure medication, they causes hypokalemia. That's the same most common thing, muscle cramps, that's what you worry about. And then the loop diuretics, right? Example is furosemide. Pay attention. They can give you something we call bumetanide. It's the same thing. They are loop diuretic. They are used in heart failure. The major side effect is hypokalemia. Pay attention. So muscle cramp. There's another thing I want you to don't forget. Diuretics are sulfa drug. And therefore, if you give it to a patient and they report of small, purple rash on their torso, you're talking about what? Stevie Johnson syndrome. That's a problem. This is a big sharp moment. You got to intervene. So pay attention. If you give loop diuretics too fast, you get ototoxicity. I'm giving you things the NCLEX will action. If you watch this video and you do a practice question on antihypertensive, trust me, you're going to see all this medication, all the side effect I'm giving you. It will be right there for you to take it. Now, let's get to it. Last ones. Now, let's get close. Now, these are the common ones. Now, these are the ones that can be a little bit intimidating. They are the alpha agonists. We saw a couple of them. We saw Clonidine, and then we saw Methyldopa. Why? Alpha agonists. They are central acting. They act in your brain. Any medication that go to your brain is sedative. That's why you take it at night. That's why we avoid it in older patients, and they can cause rebound hypertension, and you should never stop it right away. Slowly, you can use taper it, but you cannot stop it abruptly, because if you do it, it becomes a problem. This is the key thing I want you to pay attention to. And as usual, in the last summary, let's get to it and recapture everything. If the NCLEX give you a pregnant lady, you know you should avoid ACE inhibitor and ARB. If they give you asthma patient, non-selective beta blocker, go away. If they give you bradycardic patient, beta blocker, calcium channel blocker, away. If the patient has kidney disease and he has proteinuria, you know ACE inhibitor, ARB is your best friend. This is NCLEX Pharmacology, antihypertensive in the all way of medicine. Patients who have hypertension. Thank you for watching. And if you like this video, just put a comment down and let me know where you are watching from. Good luck with your exams. And I'm going to link a bunch of pharmacology practice questions to the video. It will show up on the screen at the end screen. Thank you and good luck. Bye.